Welcome. We're so glad you're here. I am Sherry Pirazzoli, and I am honored to serve as the president of the Hearing Loss Association, Washington State. On behalf of our board of directors, thank you so much for joining us today. Our theme this year is building community through hearing access and support. This represents truism that we are stronger together, that there is strength in our community, and that everyone has a role to play in increasing hearing access and supporting our hearing loss community. As individuals, we can be hearing loss ambassadors, sharing our stories, supporting each other, and raising awareness for what it means to live with hearing loss. At HLAA Washington, we can share state-specific information, advocate for hearing-friendly laws, and build partnerships to address the issues that you tell us that you care about. Over the next 90 minutes, we will be asking you what support and information and resources you need. We'll talk with the Washington State Office of Deaf and Hard of Hearing, ODHH for short, and we'll share our accomplishments and program updates and where we're setting our sights for next year. Since we have a full agenda, we'll keep the Zoom call open for an extra 30 minutes from 11:30 to noon, so we have a chance to talk more and catch up with each other. A couple of housekeeping notes. Next slide, please. We have ASL interpreters on this call. They are joining us in support of our ODHH guests and others who use ASL to communicate. This is new for us, having interpreters on a Zoom call. So please bear with us as we master a new option. We also have card captions, which you should see populating your screen. We are using CART instead of the automated Zoom captions because we find they to be more accurate. Also, if you get disconnected and need to call back in, be sure to mute your microphone, and it may take a couple of minutes to re-admit you. And lastly, to make sure that everything runs smoothly, I'd like to introduce Carolyn Odio, board director and expert techie, to give us a Zoom refresher. Carolyn, next slide, please.
Zoom, welcome to Zoom. In the bottom left corner, click the microphone icon to turn your microphone on or off. It is a toggle. A red line appears over the microphone when it's turned off, which means you're on mute. Please keep your microphone on mute during the meeting. This helps us eliminate background noise so we can all hear more clearly. Click the video camera icon to turn your camera on or off. It's also a toggle. A red line appears over the camera icon to indicate your video is off. Click this chat icon to open the chat box. You can enter your own comments by typing at the bottom of the chat window. If you don't see this chat icon, look further right at the bottom on computers and click on the 3-dot More menu. Then click on Show Chat Previews. Click on the CC icon to turn the subtitles on, or if they're on, turn them off. It's a toggle. If you don't see this icon, click on the same 3-dot More menu on the right and then click on Captions. If you have the CC icon at the bottom of your screen, you'll see an up arrow next to it. When you click on the up arrow, notice the View Full Transcript option. Clicking on that shows the entire conversation as it's happening. Scroll to the end to see the conversation being transcribed. Once the subtitles are showing on the computer, you may click inside that box and drag it around your Zoom window screen to reposition them on a computer. To ask a question, please click on the reactions icon. That's the smiley face icon at the bottom of your computer. The next slide will show what that icon looks like. When you click on the reactions icon, you can raise your hand by clicking on the raise hand icon. This will put you in a queue in order of hands raised. When called on, please remember to unmute your microphone to speak. At the end, remove yourself from the queue. You just click lower hand. If you have any tech questions during this meeting, just chat with me. Thank you.
Thank you, Carolyn. That was excellent. Okay, the slide that's on your screen is showing our board of directors. These people are my rock. I cannot adequately express my appreciation to each of these people. Each board member works really hard to keep us moving forward and to achieving our goals. We are happy to announce that Rick Font has been elected to serve an additional term as board director. His next 3-year term begins today. Rick is also continuing his role as treasurer. So thank you to everyone who voted online to enable Rick's continued service as per our bylaws. And speaking of bylaws, our board is working hard to update and simplify the bylaws to reflect new requirements and trends for Washington state nonprofits. We hope to have this work done in the next couple of months. Next slide. HLAA Washington exists to help our members and everyone in Washington state living with hearing loss. To do that well, we need to understand your priorities and what is important to you. Today, throughout today's meeting, we are going to ask you questions via Zoom's survey feature. You'll use your mouse to answer the questions on the screen. This information will also inform our guest from ODHH to better understand the needs of people living with hearing loss. To get us started, here is question number 1. Question number 1, where do you struggle with hearing access? Check all that apply. This is where you guys get busy. Okay, So I'm looking for you guys to answer the poll. So, Anne, I'm not seeing the respondents coming through on my side.
So Sherry, we have 23 of 38 people.
Okay. So we'll have the poll open for another second or two, a few more seconds. Everyone go ahead and please respond.
So I'm going to end the poll.
Okay. And so now our results are, okay. This is really no big surprise, okay? Arts, movies, theaters, very important. Conferences and meetings, transportation. Okay, this is great. Okay, so the next question, we'll move on down to the next question. And so question number 2. How helpful is it to have assistive listening systems like hearing loops, FM, or IR systems available in public venues? Okay, so how are the responses coming in, Anne?
Yeah, so we have 53% of people who've responded.
Okay, a few more.
Okay, I'm going to end the poll now. Hurry up, everybody.
Okay, so I see 74% say very. So talking about me personally, hearing loops make all the difference in my ability to participate. Through our Let's Loop Washington program, we have helped hundreds of venues install hearing loops to help people understand what they hear. We are continuously working to bring more hearing loops to venues throughout the state. If you frequent a venue and you would like to advocate for a hearing loop, reach out and we'll be happy to help. Next slide, please. At this point in the program, I'd like to introduce our guest speakers from ODHH. Ernest Covington III became the new executive director of ODH this past July. Before accepting this new position, Ernest worked as the executive director for both the West Virginia and Rhode Island Commissions for the Deaf and Hard of Hearing. ASL is his first language. Welcome, Ernest. Joining Ernest today is Maggie Campbell, the new program manager for hard of hearing resources and consultation for ODHH. Maggie graduated from Whitworth University and started her career in social work. Maggie has been advocating for vulnerable populations in Washington State for 10 years. A very proficient lip reader. When COVID-19 and mask mandates created significant barriers, Maggie realized she wanted to put her skills towards representing Washington's hard of hearing and deaf populations. We're very excited for her new role at ODHH. Thank you for being here today, Maggie. But before Ernest and Maggie tell us more about their positions at ODHH, I thought it would be helpful for them to understand how much or how little we know about what ODHH provides. Here is our third poll question. Are you aware of the services and resources that the Office of Deaf and Hard of Hearing, ODHH, provides for people with hearing loss? And so how is the poll coming in, Anne?
We have 81% of people who've responded, so I'm going to end the poll.
Okay, so it's almost mixed, okay? So let's finish that. And now, thank you very, very much for that insight. Ernest, let's start with you.
Can you spotlight him? Because I can't see him.
Thank you.
All right. Hello, my name is Ernest Covington III. I am the new ODHH director. I really want to say thank you so much to Sherry as the president of the Washington chapter of Hearing Loss Association. It's really an honor to be here. I see that poll, it's a very close percentage to some who know about the ODHH services, and 55% do not know about the services, which is really amazing. So I want to go ahead and explain a little bit more about ODHH and their role. We have approximately 10 programs of a variety of services that apply to all deaf and hard of hearing, as well as deaf blind, late deafened, deaf with different disabilities. So really a general variety of people who have hearing loss. So I'm going to explain a little bit more about those 10 programs so that people can be more aware of what kind of services the ODHH provides. The first program is the hard of hearing consultation, resources, and I really have to say congratulations to Maggie and thank you for her to join the team. And what her consultation role is she goes to different agencies that have hard of hearing people and who are employed there. And Maggie will go and consult with them and give them information and advice about how they can create a more accessible work environment and whatever needs they might have. She'll also go to different trainings all over the state and different agencies to help them be better prepared to provide access to any employee who might need those. Maybe like a vibrating phone system or a loop system, an FM system, a caption phone. There's a variety of different services that can be used. So she goes out and trains those state agencies so they can be more prepared and have those equipments available to disperse to employees that might need them. So that's what her role is. So really more about training and providing resources and advocating, consulting, making sure all the people have access to what they need. Secondly, we have a program focused on, it's called SHS. It's Social and Health Services. So there's a person responsible to make sure all providers for case management and client services, that for any person in the state of Washington can get the appropriate client services, make sure that they have an appropriate case manager to do investigations, to make sure that they have all the resources and support they need. not just for deaf people. That would apply to all individuals, whether they're deaf, hard of hearing, deaf, blind. It would apply to any of those people. And we partner with 8 regional service centers. We partner with them. We have HSDC, that means Hearing Service for the Deaf Center. So Hearing, Speech, and Deafness Center. We also have the Deaf Blind Service Center. And the third one, Washington Deaf and Hard of Hearing, WADHH. So those are some different service providers that we partner with. We also have a program called Community Outreach, where we reach out to different communities and inform them of the different resources and needs that we provide. If the community needs any information, they can reach out to us and we can give them those resources. So that's called community outreach. We also have a program focused on assistive communication technology, or ACT. We have equipment ready to go. So any deaf and hard of hearing person or deaf blind person needs equipment or devices, we can help distribute that and explain how to get those set up. So that's assistive technology that would help them transition into, you know, maybe they have older technology like a TDY. We now have real life RTT. And so we're trying to make the transition to the newer technologies. We've also been working on relay communications. We're responsible for relay communications, and we've partnered with Hamilton Relay Services, thank you. And we partnered with them to provide regular services for all the people who might need that to connect with any person out there. We also have a different program called Equipment Loaner System. So if anyone needs some kind of equipment, we have equipment that we can loan out. Maybe that might be an iPad or a phone that vibrates, caption phone, alarms, anything that they might need. We have equipment that we can loan. If they reach out to us, we do have systems that we can loan out. So we just have to follow the requirements. As long as they meet those requirements, we are able to loan those out. If they have too much income, unfortunately, they would not qualify for that. So we're working on changing that program so that everyone can receive the equipment that they need and we can loan those out. But for right now, it is income-based. Next, we have another program that's focused on sign language interpreting contracts and resources. So we work with a variety of different state agencies in the state government. We're working with them to have interpreters ready for any deaf and hard of hearing or deaf blind individual who needs interpreting for communication access and transparency. So we'll need an interpreter for that situation to contract with them to work through that. And also to make sure that the interpreters are abiding by the policies and the pay scales and all of those variety of things. We also have interpreter contract resources advocate. It's for valuable and critical access to things and making sure that all the interpreters are falling into place correctly. And the last one, last but not least, we have a position called training and presenter. That position has been vacant and we will be filling that soon. We've already made the hiring process. So they will be starting full-time next month. And the presenter trainer will be responsible for traveling all over the state of Washington, providing trainings and lectures focused on all the different issues related to the deaf and hard of hearing and the deaf-blind community. So we want to train people to make sure people are aware and understand that sometimes people feel like they have a barrier to important information. So we are willing to go out and provide trainings and presentations to make sure people understand what is going on. So that's what those programs are. All right. And if we have any time afterwards, I don't mind answering some questions and giving some more information about those programs. All right, on to you, Maggie.
Thanks. Next slide. Thanks.
Thank you, Sherry, for the invitation to be here, and thank you all for the time and space to allow us to be here today. My name is Mary Campbell, legally, but I do prefer to go by Maggie. I'm an individual who was born with a hearing loss, and Mary, unfortunately, to me, sounds like a lot of other names. So Maggie is just more profound and easier for me to hear in big crowds. So if you call me Mary, I may not hear you. So yes, I'm new to the Office of Deaf and Hard of Hearing. I've been here a little over 7 months. My position is the Hard of Hearing Consultation and Resources Program Manager, and it is a position that is being developed as we speak. As an individual with hearing loss, and as Sherry mentioned, I lip read profoundly. I'm really good at lip reading. That's how I communicate. And when the COVID pandemic happened, it really switched up a lot of things for me and kind of changed my goals. I've actually been a social worker for a little over 15 years. I started my career in a skilled nursing facility as a social worker, and then I moved on to adult protective services. So my passion has always been the vulnerable adult community. And then, of course, as an individual with hearing loss, that's a passion as well. So some things that I've really been working on in the last 6 months really align with some of my own struggles and things that I'm pretty passionate about. I do a lot of outreach and trainings to DSHS agencies to support the staff that might have hearing loss, but I've also been doing a lot of training and education on how to support clients as well that they work with out in the field. Some of those trainings have been related to accessing healthcare and the barriers to what that looks like if individuals aren't accessing healthcare. When we look at, as an individual who came from adult protective services, we look at self-neglect cases, we have to assess cognition, and just really have these conversations with case managers about, hearing loss could be a factor. It could be a factor when you do an assessment to determine someone's decision-making. It's a factor on if somebody is accessing healthcare. It's a factor on, their cognition, if they're isolated and they're not getting out there and getting stimulated. So we talk about these resources. I've used some of the Hearing Loss Association resources, such as the CAP form and the medical placard that they have on their website, and those have been well received across the board.
Maggie,
yes.
Maggie, could I stop you 1 minute? Because in the chat, we're getting people who can't follow you because you're speaking too quickly.
I apologize. I will slow down. So just to summarize, some of the agencies that I've done presentation and work with are adult protective services, home and community services, which provide services to clients, the Developmental Disabilities Administration. I'm working with DVR and coming up a training that they would like to do for their onboarding staff on how to support the deaf and hard of hearing clients in work settings. I am working with the Washington State Criminal Justice Training Commission on coming up with an onboarding training on law enforcement interaction with the deaf and hard of hearing population. So those are some things that I've been working on. One of the things I also want to look at developing is a placard for law enforcement and emergency personnel to use as just a quick opportunity to have conversation before other means can be obtained. I've been doing, I did a focal point training for aging and long-term care Aging and Long-Term Care Support Administration on working with and supporting deaf and hard of hearing coworkers. It was well received, and I will be doing those on a quarterly basis from here on out. So that's really awesome. And I will also be doing an onboarding training with aging and long-term care on how to support deaf and hard of hearing clients. So just some of the things that I've been working on. Of course, access in the workplace is very personal to me. Accessing healthcare is very personal to me, and really supporting our clients out in the community. And I'm happy to answer questions afterwards as well.
Okay, this is terrific, Maggie and Ernest. We're so glad to have you on board, and we really, really appreciate you sharing your vision and your goals for the Office of Deaf and Hard of Hearing. And I'm so pleased to hear about the outreach, that you both are doing. So really, really good. So one of the things that we wanted to talk about next slide, please. So one issue that HLAA Washington members consistently raise is the lack of hearing access in healthcare settings, whether it's a telehealth or in-person appointment, an ER visit, or a hospital stay. It's the lack of awareness in hearing access and support from medical professionals, which is stressful and also can be very dangerous. So we're going to spend the next 25 minutes talking about this pressing issue and how ODHH and HLA Washington can help improve the situation in our state. I'd like to start by asking about the communication access needs of people with hearing loss in healthcare settings. To start, let's answer our next question. Okay, number 4. What services do you need in healthcare settings? Please click all that apply to you. Okay, and are you seeing the results?
Yeah, let's give people a little bit more time.
Sure. That'd be great. This is a great question.
I also think this is a question that has a scroll bar on the side, so don't miss some of the options. Okay, we have 64%. I think that's good.
Okay, great.
Here are the results.
Okay, so we see that people really want to have captions and speech to text and assistive listening and hospital buttons and clear mask, and some people need interpreters. So clearly we have a widespread problem here and something that impacts us all. We are all facing communication barriers. So we'd like to talk about that now. I do want to let, so let's get started. What I'd like to do is to ask each of you to think about a healthcare experience that healthcare experience of trying to manage your hearing loss in a healthcare situation. You could share a positive story or something about a communication failure. So you can use the reaction button and use that to raise your hand, and Carolyn will call on you. So who would like to get us started? I see Diana and Jackie have her hands up. Okay, so Diana, why don't you start?
Yeah. Do you want me to give some comments?
Sure.
What I find is the thing you just put on the board is not what I find is the problem is that people are not in healthcare situations aware that people have hearing loss. If they could just speak slower, if they could speak louder, if they could look at you, but they don't do that. And I have found that if when I'm meeting with a doctor and I say you're going to have to look at me or speak louder, I get that the doctor complies. I go in to get an injection or blood draw, and they ask me questions when they're looking at their computer. I have no idea what they say. When the assistants pick you up to take you down the hall, they ask you questions. I have no idea in a million years of what they're saying. I know at Kaiser they always want to know my last name and my birth date, so I give them that. Not anything I can think that they want, but I don't hear those questions, and so they need to be aware that people exist with hearing loss, and just not with. You don't just need gadgets to make people more understandable. You need them to talk louder and to look at you. And that is really important, and they don't.
Thank you, Diana. And so I did get a request, and for next time you have a comment or a question, if you could adjust your camera so that we could see you, so that we could speech read. Your face is kind of right where your name is. So I just wanted to mention, so one of the things that we've had, I'll put this up here, is this face me button, which is really, really great. So this is a button that I carry with me when I travel, and it is in my emergency packets to go to the hospital should I need to run out. So this is a great button. Next, thank you very much, Diana. So next we have Jackie. Go ahead, Jackie, unmute.
All right, greetings, everyone. I made a few notes about what is important to me. And the biggest thing is to be prepared. I recently had a surgery, and I was very, very anxious before the surgery because in the past, it has been I have not been successful in getting accommodations. So I made sure that I have the packet, that Washington State has done an excellent job at. This is, Sherry showed you the little button, but the packet is very important. In addition, when I go to appointments, I always request in advance that the healthcare professionals wear a see-through mask. I have personally not had a problem with that. So they often forget, but when I check into the appointment, I make it a habit to remind them and say, please remind the doctor and the nurse that I need the clear mask. And they have done so. But I have one more tip that you don't hear often, and that is that you bring an advocate with you. And I have not had a difficult time with anyone saying that I cannot have my advocate with me. My advocate is my daughter, Kimberly Parker, whom many of you know from HLAA and from HOPE, H-O-P-E. Kimberly being right there in the room does not only calm me down, but she is able to hear more than I do. And I understand her voice. So we were successful at the last surgery in having her right there, right through, including the meeting with the anesthesiologist. And we were so intent, I guess, on on having accommodations, and that they decided not to remove my cochlear implant device. So for the first time, when I woke up from this surgery, hearing was not an issue. So find an advocate, and I found it extremely helpful. Thanks.
Terrific. Thank you, Jackie. There really is so much value in speaking up for yourself and having the confidence to do so. And so, I always encourage people to practice at home, get in front of the mirror and say out loud, I have hearing loss, and it would really help me if you look at me when we're having this conversation, and whatever else you may need. So thank you for sharing your advocacy success story. Next, we have Mary. Mary, can you unmute and go ahead?
Okay. My complaint with medical people is much the same as the first gentleman's, where the doctor turns his back and types into his computer and continues to talk. And of course, you can't hear him. And whether there is some consideration in the placements of the furnishings in the room, so the doctor can type into the computer and yet at the same time have his face where we can see it. Because that's a constant reminder when I go to the doctor. And I want to share my first experience for getting hearing aids when I went to the audiologist and sat in the room waiting for a call. Well, they called me 3 times before a gentleman beside me said, "Are you Mary?" You're going because you have hearing problems, but both at urgency care and even for the audiologist, they come out in the lobby and say, "Mary," and you don't hear them. So there is a cause for a radical change in approach, among the medical community.
So yes, so thank you, Mary. Now, one of the things that we did advocate for back in 2016, when we had a presentation to the Joint Legislative Executive Committee here in Washington State, was for mandatory training for all healthcare workers for hearing loss, about hearing loss and how to work with patients who had hearing loss. Unfortunately, the hospital lobby is so powerful, they put the kibosh on that right from the get-go. So that was really unfortunate. And I just have to speak to this slide. I love the image of this man wearing the clear mask. I know that mask mandates may go away with the general population, but it's so important in healthcare, especially, to be able to have a clear mask. So I'd like those questions to keep coming. And next we have Chad has his hand up. Chad, you want to unmute and talk for us? Hi, Chad.
Hi, Karen. Sorry, no, Sherry. I don't know why I said Karen. Thank you all for doing this. I wanted to make a point that everyone on this call is very different from the larger population of people with hearing loss. So for everyone else here, I'm an ear surgeon, ENT. I also have cochlear implants and do the surgery. So most people with hearing loss are not like everyone on this call. Most people go for a long period of time without getting any intervention. And because of that, they don't getting the sound is not their only issue. It's also processing what they're hearing. And when you go for a long period without sound, your processing starts to become impeded. And people don't have great abstract thought or are able to really understand what healthcare providers are telling them. And I see this all the time in my deaf patients who are wanting to get cochlear implants or something. They don't really understand the subtleties of the conversation. So that is why it is so important that people bring an advocate with them to appointments and to the hospital. And one way to get around understanding, missing some of the nuances of conversation is to ask a doctor or nurse, what would you do in this situation and why? And that way you can kind of tease out some of the subtle details. So yeah, I just think that everyone here is mostly a great advocate for themselves, but need to realize that the larger community that we're trying to serve is not. And that is part of just getting the information is not always the issue. It's being able to process it. And that is a problem in people with hearing loss, regardless of how you communicate. So thank you.
You're absolutely right. And thank you very much, Chad. Okay, and Maggie, I see you have your hand up, and I was going to ask you what you thought anyway. So I'm glad to have your hand up.
Yeah, I just want to say I absolutely agree with Chad. That is why I am asking individuals like case managers and, you know, folks that are going out and doing assessment. I'm asking them, when you're having these conversations to determine somebody's cognition or decision making, we need to take hearing loss into consideration, because like he said, most people aren't recognizing it right away, or at least not verbalizing it. And we don't ever want to make an assumption that someone had poor cognition because they scored poorly on an assessment where we were speaking to them and expected them to understand us. It's a huge issue. And so I'm asking that they take that into consideration. And in regards to, people leaving doctor's offices, not having the correct information is a profound impact. One of my slides that when I do a PowerPoint, I have some statistics, and I apologize for not having them, but I think it was 44% of people in comparison with a hearing loss versus without a hearing loss. Those with a hearing loss had a 44% chance of hospitalization. And I think that really reflects to people's not understanding, the doctor's instructions or rehabilitation instructions. So it's a huge issue. And the medical field needs to recognize that hearing loss impacts everything, and they need to make it a part of their assessment.
Thank you very much. Thanks, Maggie. Okay, Heather, I see you have your hand up.
Thank you, Sherry. Actually, Maggie, I had a couple of questions specific to ODHH and what you and Ernest talked about in terms of the programs that you offer. My first question is, since you've got a training person coming on board, might it be possible for ODHH to establish a training program specific for healthcare providers?
So I don't know the answer to that. I'm not sure if Ernest would. I know previously that position really focused on the hearing loss community, so doing a lot of training and education to the community itself. But I absolutely agree that outreach needs to be done to healthcare professionals. So we'll let Ernest make the call on that.
Okay, great.
I don't know if Ernest is on screen, if you don't spotlight him. So I'm not sure. Perfect. You can see me now. Great. Thank you for that question. Good question. Yes, we do have services, a person who does the trainings for healthcare providers and the group and the different people within the healthcare community. But I did want to let you know we are coming up with a new position. We're creating it. It's not currently open, but it's going to be called the Advocacy System. So that's focused on the Medicare system, healthcare providers, to really get a feel out there of to collect information and to really go out to the different healthcare settings and provide trainings and discuss with those people how we can make improvements to accessibility for all of the deaf, blind, and deaf and hard of hearing community. But at first, I have to really say thank you to the people called medical interpreters, medical interpreters task force. Thank you. That's abbreviation is MFTF, to really advocate for the healthcare access for the needs of everyone, for communication clarity, but also we want to train those healthcare providers to really understand how important it is for access and communication, and to hear everyone's stories and struggles in their communication with their doctors and providers with the breaking of eye contact, and they're speaking away from you and they can't understand. How can we improve those things? So we're really creating a position now for training, but understand healthcare providers have a lot of power. There are so many in the state of Washington who have a strong lobby, have a strong lobbying team and a support in the law system. So we really need to find a way to work with them to meet in the middle with that conversation so that they can understand and we can understand each other. If you were in my shoes, how would you feel? So that kind of point, right? It's a good way to educate them. That's where yes, we definitely need to do that, but we also have to remember ODHH is only one of 17, have 17 staff members here, you know, and we don't really just have enough staff to serve everyone here. So it's good. It's a good start. It's a good place to start. And then hopefully in the future we can grow, meaning we'll have obviously more money coming funded from the state. And then we have the ability to go and do more trainings. But for right now, we're in the right process. We've started hiring, we're hiring people, and then we're going to start training, and then eventually it will grow. So great. Thank you for your question.
Thank you very much. And so, so I just had a couple of follow-up thoughts here. Let me go ahead and ask this question. One of the questions so when you were speaking about the services, you indicated that there was equipment that people could check out to use, say, for a medical appointment. So if I make an appointment with a healthcare provider, typically I ask, what do you have for hard of hearing people? Do you have assistive technology? And of course, I'm usually met with that deer in the headlights response. Like, what? What do you mean? Would you like an interpreter? And so I say, well, that's the right department, and that usually gets the conversation going. And so I will often ask for an assistive listening system or card, maybe a pocket talker, because I think that these people who set up these services are familiar with that. But some places come back and say, no, we don't have anything. So in that situation, could folks check out equipment from ODHH? And what would that process look like?
Sure. This is Ernest here. Do you want me to answer or Maggie? Okay, I'll go ahead. This is Ernest. I'll answer your question. First of all, understand the equipment loaner program is for people who are on low income. If they really need equipment for their daily lives, but if you need equipment to get connected for a healthcare setting, you need to contact the Regional Service Center or the RSC or WADHH or the Deafblind Service Center. They also have equipment. So if you reach out to them, they can assist in that. We do have equipment, but again, those are for people who are low income. Okay. But like you've mentioned and you brought up, we do talk about those different programs, and we are still adding that. And hopefully we can provide medical equipment there if it's needed. And then when they're done using it, they can turn it back in. But we also have partnered with other agencies like loop installing for different places. But for the healthcare setting, that's a good good discussion that we need to have. We need to talk about that and getting that set up as a new program. Therefore, we can discuss all of those equipment needs. And if somebody reaches out to us, then we can provide that and they can return that after they're done. We need to find a way to really train healthcare professionals to use the assistive technology or a video phone or a video relay interpreter or captioning or loop systems, but how to provide communication access. Also those clear masks. We need to find a solution to those topics. So that's the first step, is hiring more people, growing the agency, and then we can start working on that. But I love those ideas. They're wonderful. Good way to start.
This is great.
What we need to act on that, right?
Yes, we do. And I think, working together through, we can put laws in place, but it's the people who make the change. It's up to us to make the change happen. John Waldo has his hand up. Go ahead, John.
Yeah, hi, everybody. Some of you may remember me. I'm kind of an emeritus Washingtonian. I was actually on the HLAA Washington board for about 3 years, I think. But this mask business has been an issue for all of us, and I've kind of gotten interested in it. I'm a lawyer. What I do basically full time is advocate for those of us with hearing loss. Like a lot of people, like 84% of the people who entered the poll, a clear mask would really be very helpful for me, since I'm a good lip reader. So I have drafted a letter that people can send out to their healthcare provider or doctor saying, listen, we know you don't want to wear a clear mask all the time because they're kind of uncomfortable, but put a note in your file. Have people wear them when I come in, unless you're willing to just take your mask off. If you are, that's great. But if you're not, if you're going to use a mask, it's got to be a clear mask. I think I've sent that letter to Sherry. She may or may not want to pass it out to you. But my thought is send that out in advance. And if people would do it, that's great. And that's what's happened so far. I mean, when people have sent it out, the doctors have said, okay, I sort of get that. And even the ones who reportedly before were saying, no, I'm not going to take their mask off, have gone with clear masks. I mean, there's just enough legal stuff in there to let people know that, you kind of better do this. It's not just a matter of kindness that we're asking for. But I'm assuming that sooner or later, somebody is just going to say, no, go away. Yeah, Chad has put something up, which means we can not only complain to the state medical board, we can also complain to the courts. And Washington has great disability rights laws, great judiciary. It's a wonderful place to work.
Excellent, excellent. So thank you, John. This very much. And so we'll take this last question from Jerry. Go ahead, Jerry.
I just say, at every doctor appointment I go to, I take my telephone and I have a Otter captioning device. And even when the doctor, I always ask the doctor, may I record this conversation, which is something you have to do. And they've all said yes. And I've been able to communicate fairly effectively with that assistance. And I think we do have to take responsibility on doing what we can ourselves to do that, and without asking anybody else. We all have our phones, and so I find that very useful. And the medical practitioner is very cooperative. My issue with it at times has been that I only have a limited amount of time that the captioning is available with audio. And if there were legislation or something that would allow or require that type of thing availability on our phone for medical purposes with an unlimited amount of time, that would be very helpful.
Okay, well, thank you, Jerry. I just wanted to let everyone know that there's been some great links and conversations going on in the chat. And so I encourage everyone to take a look at that. And then we'll talk about saving the chat maybe at the end of this call. So this has been a great conversation, and I'd really like to keep going, but our time is limited, so I'm going to have to move on. So at this point, I'd really like to have everyone join me in thanking Ernest and Maggie for having this conversation with us. Very helpful to hear from you today. And we're really looking forward to continuing this work with you to help our hard of hearing population here in Washington State. Okay, next slide, please. Oh, sorry, Ernest, oh, wait a minute, Ernest wanted to say something. So let me go back to Ernest.
We need him spotlighted for the interpreter. There we
Okay.
go. Okay. This is Ernest here. Before I leave, I just want to say thank you, Sherry. I appreciate it. And for HLA for inviting us to this meeting. This isn't the first time one and done. No, we're looking forward to working together in the future. And I want to emphasize to everyone here, ODHH is under ALTSA and under DSHS, Department of Social and Human Services. And our one goal is to transform lives. That's our goal. So our mission statement, our goal is to transform your lives for the better. That's our job, to make sure that your lives are transformed by the improvements of access, to be able to communicate with your doctors, your physicians, any healthcare settings that you may be encountering with. We want your lives to be transformed in a positive way, in an impactful way. That's our goal, and we are here to work with you here in the future. We all should have to share the same issues, even though, you know, I may be deaf and some of us are hard of hearing. We all have the same goals. We all deal with the same issues with hearing loss. So again, I just want to make sure that you're aware that we are here to support you. We want to transform your lives. Thank you so much. Thank you, Sherry. It's nice to meet everyone today. Have a great day and enjoy your weekend.
Okay, thank you, Ernest. That's great.
Thank you.
Okay, so next up, we're now on to the HLAA Washington news. We have achieved some key goals and identified some opportunities that inspire our continued work. And we hope to inspire you to help us. HLAA Washington has 4 focus areas to help our fellow Washingtonians not only live well with hearing loss, but to thrive. We have support, information, advocacy, and outreach. And we want to take a few minutes to catch you up on what we've been doing in each area. I'd like to start by introducing Glenda Filio to talk about hope meetings. Glenda is not only an HLAA board director, but she's also our secretary. She runs the in-person Renton support group, and she is on our Hope crew. In short, Glenda is a much appreciated superstar. Glenda, thanks for talking to us today about hope. Next slide, Glenda.
Hi, everybody. Thanks, Sherry. HOPE stands for Hearing Other People's Experiences, and we're a virtual monthly online support group that meets. We've been meeting now for over 2 years, or almost 2 years, and we're happy to report that by word of mouth, our attendance is growing. We had 25 people in November on our last meeting. The format is welcoming, laid back, gives people the opportunity to raise issues, ask questions, or simply listen and learn. We often talk and brainstorm about hearing access on healthcare, but we also about travel or technology, over-the-counter hearing aids, cochlear implants, communication tips, and much more. In-person support groups are great, and we are meeting live in Renton again, and the benefit of HOPE is that we can reach people all over the state or country, can join, are welcome to join. So if you haven't already, I really hope you'll attend a HOPE meeting. Every month we learn something new, and it's an opportunity to share your experience with others. Also, invite people, other people you know. We promote HOPE meetings on the e-news and with a special email invitation every month. So forward it to your friends, and that could benefit with a little hope. Thanks.
Excellent, Glenda. That was just awesome. Thank you. Thank you very much. And, you know, before we move on, I would like to really give a special shout out to our HOPE crew. The name for our volunteers who launched the HOPE program and to work each month to make the meetings welcoming and beneficial. So as I call your names, HOPE crew, please wave your hand. Carolyn Odio, Glenda Filio, Devin Myers, Erling Van Demir, Jerry Policonis, and Kimberly Parker, who is not here today. Now, since HOPE is an acronym for hearing other people's experiences, it's only fitting that the HOPE crew has an acronym too. And I think this is perfect, and Kimberly came up with this. We are compassionate, responsible, enthusiastic, and wise. And indeed you are. Thank you all. So next up, we have our witty wordsmither, Joanne Dyer, our e-news editor and webmaster. Joanne is going to tell you about all of our communication channels, our new e-news, and our exciting new website. Take it away, Joanne.
Thanks, Cherry. To connect with the hearing loss community, we have a comprehensive information and communications program. How many of you have shared our website, our e-news, or our social media posts? This is not an official poll, just a show of hands. All right, if you do so, thank you. Our communications work is important for two reasons. First, people often struggle with their hearing loss in isolation, which, as we've mentioned before in this meeting, it can lead to diminished mental and physical health. But we can all help one another by offering HLAA WA resources for support. And second, by building the HLAA WA community. So how can you connect with us? Well, we're on social media, including Instagram, Facebook, and Twitter. Not sure how long Twitter will survive, but we're there. Please like and follow us, and feel free to share our content anytime. Also, we always welcome volunteers to help with our social media. This year, along with our new website, we launched our Washington State Hearing Loss blog. We publish long and shorter posts about twice a month. Some are written by us and some are written by guests. If you'd like to write a post for us about any aspect of hearing loss or your experiences with hearing loss, please let us know. Our e-news has been recently revamped. A team of us write, edit, and publish it every other Tuesday. We've gotten a huge boost in our open and our click-through rates. Our average open rate is 31%. If you haven't already, please subscribe to our e-news and feel free to share it and forward it along. You can also read our e-news directly on our website. Next slide, please. Finally, we're especially proud and excited about our new website. It was designed by a team of professionals led by Heather Patrick and joined by Peg Ogle, graphic designer Scott Marlowe, web designer extraordinaire, and Cherry and me. Lots of other wonderful folks reviewed it and provided feedback too, so thank you to all of you. Note that our new website is designed to be visually accessible to everyone, including people with low vision, and to be very reader-friendly, but also robust with comprehensive resources to help people everywhere with their hearing loss. We update it regularly. Please let us know what you think and if there's information you'd like to see us include. Some highlights of our new website, which we were hoping that we might be able to click through to, but just looking at it visually, you can see our Find Support section is a good place to start if you're new to hearing loss or new to HLAA WA, and you need to know where to go and what to do next. And remember, always, you're not alone. We have information on hearing aids and technologies, including new technologies and that vague category of hearables, which we've updated recently. We have information on our programs here, including HOPE. Our e-news is here, including our archive of back e-news issues. If you go to who we are, you can find out about our history and learn more about the people that make HLAA WA happen, some of whom you see here today. Under ways to get involved, you can find out more about how you can help us if you'd like to volunteer, and we would welcome your volunteer energy and talent. Please check our volunteer page for the type of help we're looking for and fill out a simple volunteer interest form. Finally, we'd like to get your input on our communications. Many of you have had hearing loss for years, but you might remember how scary and bewildering hearing loss can be at first. We'd like to expand our outreach to connect with people who are new to hearing loss too. So here's our next poll. Someone could put that up for me. What is the most helpful information HLAA WA can provide to people who are new to hearing loss? Please check all that apply. Do we have answers coming through, Anne?
Yeah, we're getting up to 55. People are still answering.
Okay.
Okay, we have 70% of people who've answered, so here are the results.
Okay, interesting. Connecting with others is the highest. That's very interesting. That's almost everybody needs that. Hearing fatigue. Dr. Cliff Olson has an excellent video on hearing fatigue. We can share that. Acknowledgement of the mental health impact. That sounds like a very good topic for a couple of blog posts. Thank you, everyone. Thank you for your feedback. Now I'll send it back to Cherry to talk about our advocacy work.
Jerry, you're muted.
I just see that. Thank you very much. So thank you, Joanne. And so now we're at, advocacy is my favorite part. And I like to define advocacy as changing what is to what should be. And earlier, I talked to you guys about Let's Loop Washington and our work to get hearing loops installed throughout Washington state. One of the reasons our community really embraces hearing loops is that it makes it really easy for those of us with telecoils in our hearing aids to come into a place that's already outfitted with hearing access, sit down on the back row, and simply push a button on our hearing device and tune into clear sound. There's no request for accommodations ahead of time. It's simple, it's easy, and it's a universal design feature. So we also work to educate people with hearing loss about the benefits of having telecoils in their hearing instruments to make it super easy to connect to this assistive listening system, which is consumer preferred and very easy to use. There's a lot of information about this on our website. Next, legislation is another key area of advocacy for HLAA Washington. Getting laws drafted and passed can take a long time and many legislative sessions. This allows us to build relationships with legislators while educating them about hearing loss, our unique communication challenges, and developing support for hearing-friendly laws. Currently, we are working on private insurance of hearing aids for children and adults, hearing access in healthcare, and more widely available open captions in movie theaters. Next. And so for the past year, we have been working with the Washington State Association of the Deaf, Karen Atwood. I give a shout out to you. And then also we've been working with Representative Tina Orwell and also John Waldo about supporting this effort for more open caption movie theaters. On a final note, we use our e-news and website to keep you apprised of our advocacy opportunities. We try to make this as easy for you as possible, but we need you to take action. Next quarter, we'll share more with you with a special legislative meeting. Okay, next slide, please. To maximize our impact, HLAA Washington partners and collaborates with multiple organizations, government agencies, and nonprofits. This way, we can leverage our voice by adding it to like-minded groups. Beyond having ODHH join us today, we are working with them on communication tools to help consumers with hearing loss. We belong to the Washington State Senior Lobby, which is made up of over 30 different groups and state agencies, nonprofits that focus on the needs of seniors. For example, AARP, all of the area agencies on aging, League of Women Voters, disability rights, elder law, are just a few. PAIR is a Washington state effort towards improving equity, racism, and equal opportunity across multiple demographics. This is a great networking opportunity for HLAA Washington, and we're working with some really lovely people there. Whole Washington is the group advocating for universal health care, and in their platform, hearing health and care would be covered by the state. This is just a small sample of the different groups we are working with. If you work with a group or a part of a group and you would like to have an effort that HLAA Washington should engage with, just let us know. Next slide, please. Our board director, Rick Font, and Jack, Master of all trades, will speak to community engagement. Rick?
Good morning, all. I'm Rick Font, as Sherry just mentioned. And my part of this is to talk a little bit about the picnic we held in September. I don't have any way of looking at everybody involved here. There's 35 people. So a quick wave of hands if you went to the picnic. I don't know how we're gonna do that. Okay.
Oh, I didn't.
The picnic went fairly well. We had a couple of little glitches. The primary one is somewhere with the city of Newcastle. They overbooked the facility, so we left early. And as I recall, nobody showed up later that afternoon. So we probably didn't have to leave at all, but lessons learned for next time. It seemed to be pretty well received by everybody that was there. There was a relatively small turnout, but bigger than I expected, considering it's the first in-person picnic in several years. Everybody seemed to have a good time, so I'll run with that. I'm not sure how we're going to annotate this. Having our meetings, would people prefer them in person or Zoom? Or maybe a hybrid meeting? We have an in-person meeting with Zoom capability. If you have any thoughts on that, it would appear probably to enter it into the chat box here. And that would help us to annotate the general desire and work towards incorporating that. With the loosening of the COVID stuff, in-person meetings are going to become more and more common. So on that note, I will ask you for your thoughts in the chat box and give this back to President Sherry. Thank you.
Thank you, Rick. That was great. And I just have to let everyone know that Rick is our master chef. He brings his own barbecue grill in the back of his pickup truck and is a fabulous chef and prepares our burgers and hot dogs and sausages for our picnic. So thanks again, Rick, for the many, many things that you do. And I think you are probably the only board officer who has served in every single officer role. So thank you very much for your service. So next slide, please. So here we go. Everything that we do in HLAA Washington is defined by the strength of our community. Each of us can contribute to building our community by raising awareness and supporting people with hearing loss and working to increase access in our daily lives. You are essential to this effort. And the good news is that there's so many ways to get involved. Join or start a committee on something that you care about. Write a guest blog. Join our board of directors and go to the website and check out our volunteer form. There's lots of opportunities and you might find just what you're looking for. As we're nearing the end of our calendar year, if you're considering philanthropy, HLAA Washington is an all-volunteer organization, and we rely on your donations to continue the work that we do. Each of us has an opportunity every day to be a hearing ambassador. Being an ambassador simply means saying, I have a hearing loss, or I need hearing help out loud. When you share your hearing loss with others, or let people know that you wear hearing aids, or encourage friends to get their own hearing tested, you are being a hearing loss ambassador. And absolutely, first and foremost, ask for hearing access in the places you go. This is a powerful way to raise awareness. And finally, either join or renew your HLAA membership. Your membership makes HLAA stronger. As a resident of Washington State, when you join the HLAA National Organization, you also receive a membership in our HLAA Washington State Association. So joining creates a membership at both the national and local effort. Next slide, please. So thank you very much. This brings us to the end of our 90 minutes. But as I said, we'll leave the Zoom call open for another half hour for anyone who would like to stay on. This will give us a chance to ask and answer more questions, share stories, and just catch up. But before we close, I would like to thank everyone who has been instrumental in today's meeting. Ann Thomas developed our beautiful deck, helped us troubleshoot and ran our poll questions. And Alan Katsura, who is managing the recording of this meeting so that we can share it with others. Carolyn Odio, in addition to giving us a Zoom tutorial, managed the chat space during this call. Joanne and Heather, and thank you all so much for your help. And I'd really like to thank Ernest and Maggie from ODHH for joining us on a Saturday to tell us more about themselves and their work. And most especially, I'd like to thank you, our members. HLAA exists for and because of you. Our hearing loss community is made stronger because of each of you. Thank you very much. So now we'd like to hear from you guys. And if anyone would like to raise their hand and say hello or ask a question or provide a comment that they didn't do earlier, now's the time. Go ahead, Carolyn.
Yes, I just wanted to explain how to save chat in case some people are leaving the meeting. I did put it in chat, but if you look at your chat, open it up by clicking on it, it will be at the bottom. And if you don't see it at the bottom, go to that 3-dot more menu over on the right, click on chat, and you will go to the very bottom of chat. In the right corner, there are 3 dots next to the smiley face. Click on the 3 dots, and there you will see save chat. So click on save chat. Now you're going to wonder where it's going to go, right? It will actually go to your computer, and in your documents folder, whether you have a PC or a Mac, there's always that documents folder. Zoom creates a subfolder inside of it, and it goes into that Zoom subfolder chronologically by date. So you can look there once it disappears off your desktop.
Great. Thanks, Carolyn. And one thing I just wanted to say, it would be great if folks could just enter their name in chat and where you live or where you're joining the meeting from. That would be great if anyone would like to do that. So I'll go ahead and let other folks raise their hand, and feel free to ask a question or leave a comment. So Arlene, go ahead.
This is just a question in general. You know, every year we have Give Big about the first or second week of November. Didn't we participate in that this year? I didn't get any notice about it. I want to donate money.
So, yes, that's a great question. This, you can always give through our giving program any time of year. When we set up Give Big, initially it was only available in May. And so we chose to do it in May in celebration of May is Better Hearing Institute.
Okay. Thank you.
But we welcome donations anytime. Elizabeth Jensen, I see your hand is up. Hi, Elizabeth.
I just want to share a tip that has worked for me. couple weeks ago, I had major dental work to be done. I called the day before to the receptionist, explained my situation to remind the staff that I cannot hear behind the chair. And then I brought my bogey board. It's like this, and you write on it and you can clear it with a button. I put this in my lap, and if the dentist or the assistant starts talking to me, I hand it to them and they know what they need to do. It works. It helps. So just a tip.
Okay, great. Thanks, Elizabeth, for sharing that. So go ahead, Nicole. Welcome. Nice to have you join us today.
Thanks. No question. I just wanted to thank you, Sherry, for inviting me. This has been a really great meeting to listen in on. I appreciate all of the wisdom and thoughts and lived experience shared. My name is Nicole Osa. I'm also at DSHS along with Ernest and Maggie. So just wanted to thank you for that invite, Sherry, and tell you how excellent it's been for me to be here. So before I leave, so thank you.
Thank you for joining. Thank you.
All right. Bye-bye.
Sandy, I see your hands up. Unmute. Go ahead.
Well, I'm trying to find me. Well, can you hear me?
Yes, we can.
Okay. Well, Sherry asked me earlier if I would make a statement. She pretty well covered what I was going to say. But hearing loss is Washington is here for you. If you've been helped, why not join us on the board? Handy information and friendship makes the happy heart, and it helps the hearing too. Where would I be if someone didn't reach out and help me? All I said was, please face me, I'm hard of hearing. That was in 1997. And here I am today on the board. Just yesterday, I was talking with a technician at Verizon about speech recognition, and immediately he said, how can I get help for my mother? So no matter where I am, I have my information handy. When people ask, give advice. Make it short. Seek help. Find an audiologist, preferably close to your home. Take the 2 tests, words and sounds. That test will tell them what they did not want to HEAR. You can offer to go with them. There's no such thing as a stranger in hearing loss, let me tell you. When you needed help or a little nudge, you got it. So go with it for others. We are there for you. Hearing help has been updated, as you know, through the movies, Sonar, John, me. Go and support them. Use the captioning. Speech recognition on your phone. I know a lady who still has the TTY. My husband has TV streaming. Cattails on the phone. Have you ever been looped? And if any of you don't know me, I make it known nicely that I have a hearing loss. Just ask the 1,000 travelers I was with at St. Louis, Missouri airport when I was supposed to be in Nashville, Tennessee.
Thank you, Sandy. That was just lovely. I mean, you knocked it out of the park. Totally awesome. So thank you, thank you. Okay. So would anyone else have anything that they would like to share? Comments you'd like to make? One of the things I'm wondering here is if Walt Bowen is still on the call. If he could speak to us. Hi, Walt. So Walt's he's the president of the Washington State Senior Lobby, and he's been a great mentor and friend to the Hearing Loss Association and has helped us champion several bills and legislation. And Walt, what would you advise for us in terms of moving forward with a legislative agenda for 2023?
Well, you've talked about a number of very important things. And so I'll just tell you what the schedule for legislation activities are so that you can keep in mind where you can advocate. The session starts on the second Monday in January, and it will last, it's a long session, it's 120 days. And so bills are being introduced now. As you know, the election was over, and so we know who the legislators will be. So they start their deliberations on bills there in January. That first week is a lot of ceremony. The governor and all the people get sworn in. And so that's gets pretty exciting. You'll be able to monitor the activities of the legislature by TVW. You can access that online, and they have captioning as well. So that's one way that you can do it. You can do it through your cable TV, or you can use your computer to access TVW, and you can look at the hearings, the records of the hearings, and follow the hearings as they go along. The first part of the session, the first maybe 60 days, are spent on having committee meetings to discuss the various parts of a piece of legislation, like a hearing aid bill. There would be people discussing why we need a certain kind of a hearing aid policy. So you can look at those hearings as well, accessed through TVW. So you can monitor all of that and then participate by writing letters, and most importantly, find out who your legislator is and contact with them. Now, the legislature just been elected, and so you know who got elected. And I would, if you can, contact them now, because they have more time. And as you've already discussed today, it takes us a little longer to communicate. So if you can talk to them before the session in January, that would be helpful to them. Most of them I talk to would like to hear from you, because this is important to them. And so if you have a chance to call them or even write an email to them, they would appreciate it, and it would certainly help our cause. This is a continuing education process that you're embarking on, and it's going to go on for some time. But all of us together have to keep educating and putting the messages out. So I'd contact your person that got elected before the session, talk to them to see what they think, and they probably have somebody with a hearing loss, and get them to talk about it and get them to think about it. And then you can also give them an idea of how it would be useful for them to communicate with you, and how important it is for you to know what they are thinking.
And so if you can impress on them that you are interested in what they're doing, you will make a big difference and a lifelong friend. So I just throw that out there. The senior lobby has monthly meetings. We will meet in November 21st and another one, I think, on December 19th. And we will be looking at the legislative priorities for the 23 session. And so I think Hearing Loss Association is going to be on one of those days. I don't know which one. I haven't seen it yet, but so whatever the priorities that your organization has, I think Sherry will be making a presentation to us about those priorities, and then we'll take a vote. And so whatever you've come up with, we'll take a vote. And after we voted during the legislative session, whenever there's a hearing or a bill or any kind of activity regarding your legislation, the senior lobby will be marching right along with you. And we'll be getting other organizations that advocate for seniors to be aware of this important thing, because all of their members, many of them have hearing loss as well. And so the advocacy for hearing loss goes all kinds of directions, every direction, 365 degrees. So it's not just the legislature, but everyone else. I want to throw out one other thing. This is probably longer than Sherry asked for, but many of you, I think, indicated today that you are part of Kaiser Permanente. And they have a monthly senior caucus meeting. And they had that when they were group health many years ago. And we got that to be carried forward to now Kaiser. So that meets on the first Friday of the month. And if any of you are interested, let Sherry know. She'll get a hold of me and I will get you the Zoom link that you can participate in that meeting. And another way to stay informed of changes in healthcare within the Kaiser system. The meetings are about an hour and a half. And if there's a way, I'm going to try and get this topic on their agenda so that there becomes a discussion with that senior caucus to help influence the providers at Kaiser Permanente. So we can influence some people to modify the delivery of healthcare without legislation by just some of our exchanges and experience. So I'm excited to work about that. Another one last thing is right now you are being inundated by organizations, companies wanting you to sign up for their health plan. The political ads are gone because the election is over, but they will be replaced by all the ads for you to sign up for some kind of a healthcare plan. So in January, when all of this is over, January or February, I'd like to be on the meeting and maybe get some of your impressions about how that whole process worked, because we're also working on federal legislation having to do with how the Medicare has been working and so on. So I'm interested in how that your experience with this program. Is it a way that you can understand? Does it cover your needs? Those kinds of things as you go through that experience. So thank you very much for all of you to be here today. And I look forward to seeing you during the legislature. The legislature this year will be more in person than it was in the past. It went to Zoom the last couple of years, but now they're going to have in-person hearings. And so there'll be many more people in Olympia, but you can still participate, as I mentioned, by Zoom if you want to testify or follow the hearings, because that Zoom capacity was established during COVID and it will remain. So thank you very much, Sherry, and thank you all for inviting me to be here today. I found it to be very, very interesting and very helpful as we advocate for seniors.
Thank you. Thank you very much, Walt. I appreciate that. You gave us a lot of good information. So Carolyn.
Yes, just another Zoom tip. There are a couple of documents in chat, and I know you may not be familiar with how to retrieve them, But what you do is you click on them and it will come onto your computer. You can save them onto your computer and open them. So I just wanted to let you know, mine is a PDF, a list of hospital kits that I've come across. And if you have any hospital kit to add to that list, you can email me. I'll put it in the chat, my email. And then John Waldo, I believe, put his letter in the chat, and that's a Word doc. So if you don't have Word doc software, you won't be able to open it. But if you do, click on it and it will also save to your computer.
Okay.
Any questions?
I think that's great. I'm just trying to search through right now to find the Word documents that you were mentioning, and I found it just right now. So perfect. Thank you very much. Okay, Chad, you're up.
He doesn't
Hi,
have his
Sher.
video.
Hi again, Sherry. I wanted to share with everyone that one of my goals in medicine and as someone who takes care of people with hearing loss is to change the conversation about how we educate patients about hearing loss and how we treat it, and have a much better system of counseling for getting people to where they need to be, because we focus so much on giving cochlear implants or hearing aids or just getting access to sound. And hearing loss affects communication globally, not just how we take in information and process it, but also how we express ourselves. And that is what my long-term goal, because I feel this is very highly correlated to how well people do with hearing loss. So I've partnered with the Hearing, Speech, and Deaf Center in downtown and have a clinic 1 day a week. And our goal over time is to create a clinic that is able to be scaled nationwide or internationally, and how create a model for other people. So one of the things that I've been doing recently is been giving a series of talks on how hearing works, like what your doctor is not telling you, what your audiologist is not telling you, how communication works and how hearing interfaces with all that. And then this, of course, is shaped by your prior medical diagnoses, any things that affect mental health, like trauma from ableism and stuff like that. So I'm going to be releasing like talks and stuff on my webpage, which Carolyn was so nice to share. So if you want to stay updated, if you ever have any feedback for this type of stuff, please let me know. You can sign up for the newsletter. We're going to be releasing some of this stuff, but people's feedback is very useful because I learn a lot from just being here. So anyway, thank you. Thanks for doing all of this and for everyone's great advocacy work, because that really is where it's at.
No, thank you, Chad. It's so great to hear from you, and you bring a great voice to this conversation. So I look forward to working with you later. Okay, does anyone else have a comment about healthcare or their experiences, or just anything else they'd like to talk about today? Okay, Debbie is waving. So Debbie Pearson, if you're waving, would you want to unmute and talk to us now?
Me now? Okay, some time ago, I saw a little video about like the mic. I would like to see other videos about good ways and bad ways to advocate, good ways and bad ways to do this, good ways and bad ways to do that. Something fun, but also connecting. Because sometimes you hear things that are just, or read things that are just really dry. These are the steps to do whatever. And I'm like, yeah. So something that brings us into those conversations. What do those conversations actually look like? And, you know, what's a good way, what's a bad way? Something like that.
So that's great, Debbie. And I'm hearing you say that that role playing could be a really good teaching tool in terms of maybe role playing a hospital scenario or conversations about talking with your hearing health provider about your hearing loss and those tools, or maybe even just talking to your supervisor about different advocacy tools. So is that a little bit about what you're saying?
Yes.
And those are some great things that we have all seen at the convention. And I'm also going to say that we had previously Judy Carr, who was on our board, and also Karen Utter, used to do these hospital skits. They were very good. They were wonderful at doing that. But now we're kind of moving on to video. And I'm going to kind of give a shout out to Carolyn Odio, who I know is taking video classes now. And maybe we put this in our to-do list. So. And Anne, do you have any ideas about steps for some of this process? Go ahead, Anne.
Well, actually, Sherry, I think that we should let everybody know about the step-by-step guide to advocating for hearing loops. This was a perfect segue into that. So Sherry and Joanne and I sit on the HLAA Get in the Hearing Loop Committee, and Sherry's the chair. And we had a tremendous amount of help from Heather Patrick, who's on this call in this meeting today. And just recently, we've released the advocacy guide. And Sherry, do you want to talk some more about it? It has everything. We have an advocacy guide. We have a toolkit. We have a toolkit handbook. But the pieces in the advocacy guide, there's something about it that I think that's really, really very special and unique. It was designed addressing hearing loops, but the techniques and the process that Heather helped us develop applies to almost everything. So if you just manipulate a little bit of each one of the topics, you could have it be for hospital kits. You could have, hospital advocacy. You could have it be for your personal life, because the pieces and the components of it are very broad in scope, and then fine-tuned to give you examples of what that would be like. So please take a look. It's on the HLAA website. If you go to the link, and it's in programs and services and hearing loop, there are 3 different locations there. So check it out, and we hope you like it, and we would like feedback from you.
So yeah, and there's really nothing else I can add. You did such a terrific promotion and plug for this. This is wonderful. This is the kind of a culmination of 3 years worth of work to put all of this together. And we're just so pleased that we actually have it all together, a resource for advocates. And it all came about because Anne and I realized that asking for hearing access and asking for hearing loops was way more complicating, or actually getting hearing loops installed was way more complicated than just simply asking. So Walt has his hand up.
Yes, just to follow up on the hearing loop, which is Sherry and I worked with the legislature a couple of years ago to get a hearing aid bill passed, and it passed, and we're still working on getting it to be properly implemented. But we had discussion with legislators about the hearing loops and going through an inventory of the hearing rooms in the legislature. And in that process, it turned out that they thought they had some kind of a way that that people could hear, but the system they had was very defective and was not working very well at all. So we raised the issue of hearing loops in the legislative hearing rooms, which there are many, and then also to get hearing loops in our courts. Well, since all of that, we would have had some momentum and still been working on it, but then the pandemic hit. So as the pandemic hit, then the legislature didn't meet, so the hearing rooms weren't used, and the courts have been all stopped up and they're all behind. So the courtrooms have not been used, but they're starting to come online, and they're going to have in-person hearings, and many the courtrooms are starting back up to work, and many other organizations are starting to have in-person meetings. And we're having entertainment coming up now. There's more plays and other kinds of entertainment for people to be involved in. So now comes up the hearing loop options and stuff has kind of went dormant, but now it's started to come up because of people who are recovering and from the COVID activities. So it's just something for us to, to kind of think about. This is a never-ending work, and this is unfinished business that's ahead of us that we already started, and we need to kind of revive it up before something else takes up that space. So I just thank you, Sherry.
Thank you, Walt. Okay, so I know the ASL interpreters are going to have to leave, and I want to thank you very, very much for joining us today. And so if you need to log off, that's okay. That's okay. So thank you. Anne, go ahead.
So I want to dovetail onto what Walt was talking about and make sure that everybody knows that the HLAA Get in the Hearing Loop Committee approached Google to include hearing loops on Google Maps. And I'm very proud and happy to let you know that we were successful. So starting in the spring of this year, very slowly it started rolling out, and you will continue to see more and more of them. We seeded them with over 5,000 hearing loops in the United States. The seeding that we've been giving them is going to eventually go internationally. So if you happen to know of a hearing loop that isn't on Google Maps, so if you go and look at Google Maps, you go to the About feature on your phone and scroll down, and then there'll be something that says accessibility. And in there, Google decided to call it assistive hearing loop, and they're there. And so before you go, you can plan before you go. You can go, hey, listen, I'm thinking I want to go here, but none of us want to go anywhere where we can't understand anything. So you can just pull out your phone and see if they have a hearing loop.
So that's great, Anne. And I just wanted to let everyone know, in our upcoming e-news, we do actually have a blog describing and telling a little story about that. So look forward to your next upcoming edition of the HLAA Washington e-news, because we do have the story in our blog. And while you're all here, I'm just going to show you the hard copy of, I can't get the show, of our piece.
Sherry, it's the problem with the background. Whenever you have a background on, it doesn't like it.
Yeah. So anyway, I do have this great book. It's very beautiful. And Anne probably has one in her office. So yeah, that's what our book looks like. So yeah, so it includes all the laws about hearing help, hearing access, all the laws that you need in the back. And then again, the step-by-step how to advocate in your community. So that's great. And so Heather has put the 5 steps in the chat. So just keep saving the chat. You'll have all kinds of information. And it is 12:05. And so I'd just like to thank everyone for coming today, and especially my back end people and my board of directors and everyone who really contributed. You really made our meeting